Hello everyone, I am going to give 8 images of X-ray chest and the question in each is whether it is done as X-ray chest PA view, posterior-anterior view, or as X-ray chest AP view, antero-posterior view. And please think about the reason why do you say that way. First image shows fracture in the left clavicle, but tell me whether it is done in PA view or AP views and tell me why. Second image shows right lower lobe mnemonic consolidation. Is it PA view or AP views and why? The third image shows features of dilated cardiomyopathy with bilateral pleural effusions. But the question is AP or PA view. Fourth image shows sternotomy sutures with left pleural effusion. Is it PA or AP view and why? Fifth image shows pacemaker in situ. What about PA or AP view and why? Sixth image shows right hydropneumothorax. Is it PA or AP view and why? Seventh image shows diffuse haziness in the bilateral lungs, more in the perihilar levels as in viral pneumonitis. But is this PA or AP view and why? Eighth image, last one, is this PA or AP view and why? I have given the images for only for few seconds, and if you want more time, please pause the video and go back to see the images again and reassess. This quiz is not only for radiologists but also for the undergraduates and postgraduates, and also for the consultants like physicians, surgeons, anesthetists, and some of the super specialties who are all dealing with X-ray chest every day. Now I am going to give the answer, and if you are correct, I mean if you are 8 out of 8, you can quit the video right now because you know what I am going to talk and you are very great. Now the answers I will tell. The first and 8th, 1 and 8 are X-ray chest AP view done in supine position. The fifth one is the X-ray chest AP view done in erect position. The rest of them 2, 3, 4, 6, 7 are the X-ray chest PA view done in erect position. I have to give you a flashback now. Many years back, one X-ray technician had been there in the night calls in our hospital. He liked it due to the very minimal workload. Sleep had been interfered only 3 to 4 times a week. One of the surgeons in our hospital used to do only X-ray chest PA view in acute abdomen, especially in younger individuals, to rule out pneumoperitoneum, whether free air could be seen beneath the right diaphragm. And the same X-ray chest is also needed for pre-surgical workup for the anesthetist. Once for the night call, after seeing ultrasound abdomen of a patient with acute abdomen, I reported it as significant ascites with sonographic free pneumoperitoneum, which is suggestive of perforative peritonitis. Next day the surgeon met me and started praising me in exclamation. "You're a great man. You are picking up the pneumoperitoneum so easily, which is not picked up in the X-ray chest." He also added that this is the third case where X-ray chest is negative on pneumoperitoneum. I felt something is wrong and then went to the X-ray department, and after seeing many of the X-rays done in the night time were looking fishy, most of the AP views being labeled as PA views. This had not been recognized by the surgeons and the anesthetist and also by the physicians, and after discussing with the technician, the truth was expressed that the patient on stretcher from the emergency room, the technician said, "I do the X-ray chest in supine position, but label and mark the film as PA view." Oh my God. So that's the problem. So that's the background for this quiz. And after this presentation, I think anyone can recognize and identify X-ray chest and identify whether it is as AP view or PA view. First of all, we'll see how the X-ray chest PA and AP views are being done. It's very, very important. X-ray chest PA view is done with the patient in erect position, in standing position with the back facing the X-ray beam, and the cassette is touched by the chest wall, routinely done with the shoulder girdle adducted and the shoulder joint extended, and the elbow joints semi-flexed with flexion and adduction of the wrist joint. But you can see the image. So this is the way usually done in most of the people. But in patients who are morbidly obese and other have orthopathies, then it might be done like this. They can hug the cassette and it can be, means X-ray chest PA view can be done. You can see in the image. Then the X-ray chest AP view is done with the patient in supine position with the chest wall facing the X-ray beam and the cassette is near the patient's back. You can see in the image. This is done in patients with fractures in the pelvic bones or in the lower limb bones where they cannot stand. And the X-ray chest is routinely done in bedridden patients and in ICU patients. During our MBBS, these are the points which are taught to us to how to recognize the X-ray chest, whether it is as PA view or AP view. In the X-ray chest PA view, the first one and the easiest one is to have air fluid level in the fundus beneath the left diaphragm. This is, I think, everybody knows. The second one is to have horizontal position of the clavicles in PA view. And the third one is to have scapulae away from the rib cage. Now, whereas in the X-ray chest AP view, there is no air fluid level beneath the diaphragm, that's usual. And there might be oblique configuration of the clavicles with lateral portion of the clavicles, acromic clavicular joints seen well above the rib cage, and the scapulae will be overlying the lateral parts of the ribs. But in our quiz, we will misinterpret by the configuration of the clavicles in 3 X-rays. In the quiz number 5, there is visualization of fundic bubble with air fluid level, which is highly suggestive of PA view. But my X-ray technician did in AP view because the patient had undergone pacemaker placement just few days back and he was in a lot of fear. He did X-ray chest AP view with the patient in standing position. So that's why you can see the air fluid level, but still it's a AP view. And lastly, 2 theoretical points are also mentioned in some of the books about X-ray chest AP and PA view. First one is about the apparent cardiomegaly might be seen in AP view, but the second one is about better visualization of the anterior or posterior ribs in the AP or PA views respectively. They say, in my experience, both of them are almost useless during our practice. And actually, the posterior ribs have more bony configuration and are better seen in any views, AP views or PA views, because the anterior ribs have more cartilaginous configuration in the medial portion and so not well seen. Now I am going to give you the 5 crucial points while seeing any X-ray chest. They are simple and superb. If the X-ray chest has 3 out of the 5 points, you can definitely say whether it is PA or AP views. Only very rarely you might have discordance. These are the 5 points to say whether PA or AP views. So I will go from the top to the bottom level of any X-ray chest to say whether it is we are seeing a PA view or AP views. Now in PA view, we can see arrowhead sign in C7T1 level. Second one in PA view, horizontal appearance of the clavicles. Third one is spine of the scapulae outside the bony rib cage. Fourth one is presence of straight air fluid level in the fundus. And lastly, it is mentioned as PA view or not. In AP view, we will have rectangular sign in C7T1 level and we'll have upward angulation of the lateral end of the clavicles. Spine of the scapula is touching or within the bony rib cage. And fourth one is there will be no air fluid level within the left diaphragm, but sometimes the colonic gas will be mimicking that way sometimes. Remember that. And the fifth one is whether it is mentioned as AP view. The first one is the C7T1 level, whether it is arrowhead sign or rectangular sign. I am giving the magnified image of the C7T1 level, which is eye-catching to say arrowhead sign for PA view. Next one you can see in the AP view, the magnified image of the C7T1 level giving the rectangular sign for AP view. The second one is the horizontal appearance of the clavicles in the PA view and the oblique pattern of the clavicles in the AP view. But it is not very sensitive and not specific. But next one is the appearance of C7T1 and the clavicular configuration might be sometimes confusing due to the wrong postures of the patients or due to rotation of the X-ray beam, especially in the ICU setting, or the patient has some bony deformity. The sign in C7T1 is more sensitive and specific than the clavicular configuration. But what I am going to talk about is very sensitive and more specific during our practice. This sign is called as spine of the scapula hanging in the clavicles. The sign looks long but very simple and practically useful. You can see the image for the hangers in a rope appearance. We see in most of the homes with our shirts being placed in the hangers. Now you can see this picture of its resemblance due to the hanger appearance of scapula in clavicles. This is due to the magnification and lateral rotation of the spine of the scapula, which is being the first bone to be touched by the X-ray beam in the PA view. The hanger appearance of scapula is due to the upward rotation of the scapular parts of superior angle and also due to the movement of the crest of the scapular spine over the lateral half of the clavicle. This hanger appearance of scapula is highly sensitive and very specific if the X-rays have been done in standard PA view, in either upright or recumbent or sitting position, and this can be visualized even in expiratory efforts, right? The hanger appearance of scapula might be sometimes negative due to very improper positioning or due to shoulder orthopathy or due to some other complicated cardiopulmonary failures. The fourth and fifth points need not be discussed. Fourth point is the air fluid level in the fundus beneath the diaphragm, and fifth point is the marker as PA or AP views marked by default in the machine or marked by the technician. So we are at the final round. finishing by reanalyzing our quiz with our 8 X-ray chest. The first X-ray is a AP view, and you can see that C7T1, you have the horizontal pattern between the C7T1 level. So again it indicates AP view. The clavicles, even though that's a fractured clavicle, is upward shifted, but the right one is also has some oblique configuration, and the spine of the scapula is also overlying the rib cage. So this is very typical, that is the AP view. Now we'll go to the second one. So you can see the PA view. The C7T1 is not seen here, but when you go to the hanging appearance of the scapular spine, you can see that it's very typical to say this is PA view, nothing else. The clavicle is also very horizontal, saying that this is a PA view. So third one is the dilated cardiomyopathy with pleural effusion. Not clear about the C7T1 level, it's not very correctly done. Then the second one, you can see that the clavicles looking like AP view because of the oblique configuration. It looks like AP view, but the presence of this spine of the scapula hanging on the clavicles is very typical of PA view. This is PA view, right? The fourth one, again you can see the C7T1 somewhat very classical of arrowhead appearance. Then the clavicles are very horizontal, very typical of PA view, and only one part of the spine of the scapula you can see hanging on the clavicle, whereas on the other side, on the left side, it is like overlying. It's because of the rotation and other things, or due to the pleural effusion or some other thing. But you can see the spine of the scapula on the right side is hanging on the clavicle. It's very typical that this is PA view. And we'll go to the fifth one. You can see that's the pacemaker and the horizontal appearance of the clavicles. But the main issue is C7T1 is not like a arrowhead appearance, it's a horizontal appearance, but the clavicles are looking like PA view, and presence of air fluid level, we think that this is PA view, but we don't have this spine of the scapula not hanging on the clavicles. Very typical that this is not PA view, actually a AP view in standing position because of the presence of the air fluid level. Now we'll go to the sixth one, which is the PA view. It's very difficult. You cannot see the C7T1, and the oblique configuration of the clavicles, again very misusing, and the presence of air fluid level is very indicative that this could be either standing AP view or PA view, but the presence of air fluid levels in the hydropneumothorax, hanging of the scapulae beyond the bony configuration on the left side, PA view. 7 is very easy one. So you can see the arrowhead C7T1, and you can see the horizontal appearance of the clavicles, spine of the scapula hanging on the clavicles. So the last one, the supine position, C7T1, you can see the horizontal one and oblique configuration of the clavicles, and you can see the clavicles overlying the bony ribs. So this posted as quiz few days back. Out of the 10 participants, Dr. Kader Baksh is the superstar in this quiz, giving the correct answers with proper explanation, and Dr. Chetan Vaishnav and Dr. Lakshmi Narayanan are the shining stars, scoring 6 to 7 out of 8, and Dr. Jay Chandra Bose is the singing star, scoring 5 out of 8. I salute all the other participants who have given some correct answers without any explanations. I congratulate all the participants. In the diagnostic imaging, diagnosis is easy most of the times, but sometimes it might be tricky. You can see this picture in a riverbed with a couple in a relaxed mood in the tree background, but something is colored. We can see now an entire fetus here. In medical fields, this proverb is appropriate in all the specialties. The doctors only see what they are prepared to see. So that's the way. Now we'll go to the other one. We can come to the different background here. Now what is this? Most of us might say this could be the red parrot, but when something is magnified and focused, oh, this is a lady posing as a red parrot. Yes, now you can see the entire lady posing as a red parrot, coloring appropriately. Now rethink about the pneumoperitoneum, not seen in the X-ray chest, labeled as PA view because it had been taken as AP view by the technician. Remember that. Thank you very much for listening. Bye bye and take care.